I'm Diane Degnan from United Methodist Communications, and today we're celebrating the success of Imagine No Malaria at the United Methodist General Conference in Portland, Oregon. We're here in the Digital Lounge with our guest today, who is Dr. Christoph Benn. He's External Director of Relations at the Global Fund to Fight AIDS, Tuberculosis and Malaria. This is an effort that's not only involved the whole church, but also an effort that's involved partnerships. And so we're here to talk about our partnership with the Global Fund that started in 2010. Welcome, Dr. Benn. Thanks for joining us.
Thank you so much for inviting me.
So what message today do you bring the people of the United Methodist Church from the Global Fund?
So I have mainly one message to the United Methodist Church and all its members, and that message is one of immense gratitude for this unique partnership that we've enjoyed over the last 6 years. Imagine No Malaria has been such a fantastic campaign, and I've seen so much enthusiasm among so many people. They've been engaged, they had lots of activities in the congregations, and they've helped us, the Global Fund, to mobilize the resources so that we can serve the lives of so many people, particularly in Africa. So it has been a fantastic experience. You should know, you were the front runner. There are now several other churches and faith communities who say, oh, this is very interesting, can we also enter into partnership like that? But clearly the United Methodist Church has been the pioneer, and you should be very proud of what we've been able to achieve together.
Share a little bit about how the monies that are from Imagine No Malaria that go to the Global Fund, how are they used and what difference have they made?
Right. We are at a unique point in driving back malaria, one of the diseases that has been with humankind for thousands of years and that is still killing hundreds of thousands of people every year, particularly African children. So when we entered into this partnership, we identified a couple of African countries where we would invest together. And we picked some of the poorest countries in Africa, like Sierra Leone and Cote d'Ivoire and Angola and Rwanda, Uganda, Congo. And we started to implement really successful programs because the tools are there. You can diagnose, you can easily treat malaria, and you can provide all the families with mosquito nets so that they can protect themselves from the biting mosquitoes. And that has had such a tremendous effect. I'm a public health physician and I've worked in Africa myself as a medical doctor. Not so long ago, you will see children dying from malaria every day, every night in our hospitals. And now families are protected. The mortality from malaria globally has gone down by 60%. That is huge by any historical standard. And the programs that we started to implement, have made such a big difference. United Methodist Church mobilized about $20 million just through the Global Fund. And with those $20 million, we could purchase treatment for about 10 million people, and we could provide 3.6 million mosquito nets. So that's huge in those countries, and you've been a fantastic partner in that.
Share a little bit with us about how partnership benefits both how that makes the efforts of the United Methodist Church better and how the Global Fund works in partnership to achieve more.
Yeah, the Global Fund actually is all about partnerships. We are the main financial instrument that the world has created to combat AIDS, tuberculosis and malaria, but we could do nothing without viable partnerships. And we do work with governments, of course, in countries. We work with civil society, we work with UN organizations, but we also work a lot with faith-based organizations. Why is that? It just makes eminent sense because it's the churches, it's the faith communities that are present in the poorest countries, also often in the most remote areas. You do not just want to reach the families that are living close to the capital. You want to go the last mile to the remote places, and that's where the churches often are, where they have an enormous influence, where it matters whether a pastor or a priest educates the community about using mosquito nets and helping to spread the message. And if you combine that with the financial capacity of the Global Fund, then we have an almost perfect partnership. So partnerships are absolutely critical for the Global Fund, and partnerships with the faith-based organizations in particular.
So I know we've made some strides in reducing the death rate from malaria, but what's next in the fight against malaria? How do we get from where we're at now to where we need to be?
Yeah. When the Global Fund started about 15 years ago, our first mandate was really just, stop the killing from these diseases. I mean, it was an emergency response. Provide as quickly as you can treatment and prevention because millions of people are dying from diseases that are treatable and preventable. So that's what we did over the last 15 years with the success I described, I mean, driving down these diseases 50 and more %. Now, because of that success, we can go a step further. We can now talk about eliminating malaria as an epidemic. That is amazing. A few years ago, nobody would have believed that we can talk about that seriously, but we can now. It's even part of the new Sustainable Development Goals that the world has come together last year. All the global leaders signed that kind of contract. And part of that is end AIDS, tuberculosis and malaria as epidemics by the year 2030. So we have now gone so far that we can really finish the job. Can you imagine, 15 years from now, no kids in Africa have to die from malaria. That would be so huge, both in humanitarian terms, but it's very important for the countries. It's important for the communities, because malaria always came with a huge cost for the communities, not just because of the children dying, but also what it meant for the whole families and for the countries themselves. So that's what we are trying to achieve now over the next couple of years. Let's get together, let's strengthen the partnership so that we can really eliminate malaria from the face of the earth.
Mm-hmm. And so how do you see the future of this partnership as we begin to wrap up our fundraising goal?
When we started this partnership, we both knew, United Methodist Church and the Global Fund, that this was something quite exciting, something that not everybody had tried before, a major church and a major international organization. You have to learn how to work together. And I think we really learned how to work together. There's a lot of trust that has been built between these two organizations, and I'm so delighted to be here at your conference. And I've been attending conferences of the UMC before, and there are personal relationships, personal partnerships. So building on that kind of trust, I would really love to see us moving forward together. Because for any major campaign, you need organizations that know how they work and that there is, trust and confidence between the two partners. And I think that's what really exists, so that we can now discuss what's the next step together. There's so much to do out there. There are so many people still suffering from malaria and other diseases in Africa and beyond. We have the tools, we have the means, we know how to do that. So let's do that together, and hope we can come together for another, big assembly and celebrate the next step in our journey.
Well, we're delighted to have you today. I know you came all the way from Geneva, Switzerland to be with us today. Looking forward to the celebration later this morning. Thank you for joining us.
Thank you so much, and really all the very best for your efforts.
Join us later this morning for the celebration of Imagine No Malaria.